Researchers around the world have shown that tobacco smoke contains toxic chemicals which cause damage to the lining of the airways and the lungs. These chemicals are said to be or to suppress the activity of different types of immune cells, leading to weakening of immunity, thus impairing one's ability to fight diseases. Buttressing on this recently, the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, affirmed that smokers have an up to 50% higher risk of developing severe diseases and death from COVID-19. Quitting remains the best solution for smokers to lower the risk of coronavirus infection and the risk of developing cancer, heart disease, and respiratory illnesses. Though the WHO findings suggest the COVID-19 pandemic has made nearly 60% of tobacco users around the world want to quit, only 30% of the global population are having access to quality tobacco cessation services. This explains why the WHO came up with the theme Commit to Quit to mark World No Tobacco Day 2021. Aggressive campaigns on the dangers of smoking have been on for a long time, yet quitting remains a major challenge for those wanting to. What then can be done to help create healthier conditions that promote tobacco cessation? Well, this question and other related issues will be our major focus on this edition of Nigeria Today. Welcome to the program. I'm Dennis Adigunloye. All right, with me in the studio to discuss tobacco smoking and how to commit to quitting the habit is Senior Registrar, Respiratory Unit at the National Hospital, Abuja, Dr. Dorcas Obidia Okoro. You're very welcome to Nigeria Today.
Yeah, good evening, Nigerians.
All right, today, World Tobacco Day is marked, and that's annually. To start with, what is the significance of this day?
Okay, today marks World Tobacco Day, and this day is very important because it's channel along. It does like kind of campaign, trying to stop tobacco use. Having known that tobacco is associated with so many respiratory problems, even cardiovascular problems, as well as so many cancers, the list are endless. So a day such as today is very important to talk about tobacco, to create its awareness, and also to encourage users of tobacco to cease tobacco use. So it's very important because if such awareness are being done, it will reduce the development of all these complications we are going to talk about tonight, and it will also directly or indirectly reduce morbidity and mortality among the users. Thank you.
All right. We understand that smoking is a very addictive habit, and this year's theme is Commit to Quit. Just tell us more about this theme for this year.
Okay. Tobacco, as we all know, tobacco is just a name to a leaf, which was originally indigenous to the Americas, but now is being planted across the globe. Okay, it has more than 70 species, but the common thing about the leaves, the common characteristic seen in all these species is that this leaf contains an addictive chemical called nicotine. Apart from nicotine, it also contains polyaromatic chemicals, which are carcinogenic. Okay, so nicotine, as we all know, is quite addictive, and when a patient takes in nicotine, all right, so it goes through the airway into the bloodstream, straight to the brain, gets connected to the nicotine receptors. So when this connection is being done, a chemical known as dopamine will be released, and this dopamine gives this patient this satisfactory feeling, pleasurable feeling, and the patient feels like doing it more to have that feeling, and this leads to the development of addiction in this patient. Okay, so that is about tobacco. Then apart from the nicotine that is one of the chemicals that is in content, it also have polyaromatic hydrocarbons, which is highly carcinogenic. Okay, so
if you can break that down for
yes,
layman's
it's a chemical that causes cancer.
Okay.
And we have a long list of cancer which are associated with tobacco. Okay, lung cancer, very important. Even the lips that you use in smoking, so mouth cancer is there. Throat cancer, you can imagine. So as the smoke goes down to the lungs, it causes cancer of the pancreas, cancer of the colon, prostate, cervix. You know, the list is endless. Apart from that, children that have been born from smoking parents tend to come with a low weight, a low fetal weight, and they come down with growth retardation. They have all manner of complications, which is even enough for these parents to stop smoking. Then there are so many problems associated, cardiovascular problems. Apart from cancers, we have a lot of cardiovascular problems that are associated with tobacco. What tobacco does, when you take in the smoke, it's been said that it causes clotting of the blood. It makes our blood to thick. So when the blood gets thickened, it forms clots easily. And when these clots have been formed, it can move from one part of the body to the other, causing blockage of the vessels. And when any vessel is blocked, any vessel that is connected to an organ is blocked, it leads to failure of that organ. Okay, if the vessel within the brain is blocked, it causes stroke. That of the heart will cause myocardial infarction and so on. It causes atherosclerosis. So there is no disease you can mention tonight that is not directly or indirectly associated with smoking.
Absolutely. There have been many campaigns over the years, both locally and internationally, on the negative impact and effects of smoking, that it has led to national policies of banning smoking in public places. How effective has this been, would you say, over the years?
Oh, well, in Nigeria, I don't think that campaign is really, you know, successful in Nigeria, although efforts are still ongoing to make sure they will be able to implement it. But so far, considering the public policies, some work is still ongoing, let's put it that way. Okay, we still see people smoking around, and we know that smoking is not just, the impact of smoking is not just seen in the direct users of tobacco. Even the passive smokers, you know, they get all these complications also. So I think a lot of work has to be done. It's not enough to, you know, establish or make a policy. We have to do everything. The government has a part to play to implement it, and also to punish anybody that goes against this policy, so that we can achieve our goal.
All right, at the National Hospital where you're based, the respiratory unit, is there any kind of sensitization you do for smokers in terms of how they can quit smoking and sustain it for a period of time?
Yes, we do that a lot during our normal consultation in respiratory clinic. Okay. It even forms a part of, apart from the general clicking, if you are seeing a patient in the hospital outside respiratory unit, you know, you follow a particular format. And one of the steps is social history of the patient, which you have to ask about the smoking. Okay, do you smoke? You just need to ask that question. So in respiratory clinic, we ask that question a lot. Okay, trying to fish out, trying to get these smokers. And immediately we get one, we don't just let the patient go that way. We have to counsel, and there are basic steps in the counseling of this patient to make sure this patient achieve that cessation. Because it's not enough to tell the patient, stop smoking. It's not as easy as that. Because I've seen a patient even during my last clinic, you know, he came around, a young man of 41 years. He told me, doctor, I even smoked this morning. My father died of cancer. My mother died of this, lung cancer. My mother died of this. I'm afraid, I think I'm even having one. You know, I smoke a lot. And when he told me about his smoking history, I realized that he had a very high package of cigarette smoking, meaning it's quite significant. He said he smokes more than 2 packs in a day.
Chain smoker.
Yeah, more than 20 years of his life. You know, and he wants to quit. He said he wants to, but he cannot. So, like a patient like that, I really spend my time, you know, empathizing with him first of all, you know, advising him, reminding him about, because he knows so much about the impact of smoking, but he can't just stop. But I reminded him of some of the complications, and I now assisted him that since he has tried and he cannot stop, that we have a nicotine replacement therapies that could be used for him to stop the smoking. And we have a lot of them, like the ones you can even get over the counter in chemists without even prescription. We have gums, nicotine gums, lozenges, and so on, which the patient would take, and he will derive that satisfaction that he or she could have gotten on smoking.
It's the same nicotine in the gum, is it? Or is it like a placebo?
Yeah, it has nicotine.
Okay.
It has no. You know, the problem with tobacco is the other chemicals, the the other chemicals that cause cancer. It's not really the nicotine that is the problem.
So the nicotine,
other chemicals like the polyaromatic hydrocarbons I've mentioned. It's not really the nicotine. So you can use nicotine alone to help patients leave the tobacco, the real stuff, the complete one. So apart from the gums and the lozenges and patch, we have skin patch. You can also prescribe nasal spray for your patient, and so on. And apart from that, after advising the patient, assisting the patient, you also reassess whether this patient is still willing to drop the smoking. Then you schedule a follow-up visit, maybe on telephone, or schedule another day, monitor this patient, and many times it works. Many times, many of them achieve this cessation of smoking through all those steps if it is done well.
Very good. All right, you are on to Nigeria Today. Stay with us. We'll be right back. Let's hear from some Nigerians on smoking and how best to quit.
Though this thing, whenever I smoke, I feel that the smoke disturbs my cost of, for breathing. So there was a time I have a challenge with health, and I went to the hospital. So doctor was asking me that I should quit smoking. So I was asking myself, how can this, work out for me? So I started asking, and started praying. You understand? So all of a sudden, the urge of cigarette just died for me.
Yes, I do have experience when I was growing up, you understand? But with time, I decided to look into it and say this is it's detrimental to my health. So what's the essence of me smoking is? She does give up and stop it. And I pray to God, and God give me the grace, and I stopped it.
I smoked for quite a time, but I decided to quit on my own. You understand, when I sense that the people around me and that are influencing me are not really doing good to me. You understand? So on a personal ground, I decided to quit. Not because somebody coerced me into doing that.
I have a friend who say he want to quit, and actually he let her quit. And that time I normally advise him that if you take like 3 sticks or 4 sticks in a day, reduce it to 1. Gradually you can stop it. And he did. And now I don't think he's smoking again.
Smokers, they will start by way of always licking sweet or tom-tom or something gradually, because this habit is being formed over time. So for them to just quit, they have to take it gradually. And 2, there are some environments you find yourself that actually encourages smoking. As a result of that, they will withdraw themselves from such gathering or such association. So that is another way of making sure that they quit smoking finally.
You're welcome back to the program Nigeria Today. If you're just joining us, we are discussing quitting smoking in the context of World No Tobacco Day, which is today. We have Dr. Dorcas Obidia Okoro, Senior Registrar, Respiratory Unit at the National Hospital, Abuja, here with us in the studio. Dr. Dorcas, you heard some of the comments from former smokers. No doubt you've heard a lot of what they've said in your clinics over the years.
Yeah. Even from one of the comments made by the people out here, about smoking, a man said that the environment you find yourself matters a lot. That's very true. Even in the hospital, we advise our patients, especially those of them we are grooming to stop smoking. We advise them to keep a proper setting, proper environment, meaning you have to, first of all, the leftover cigarette packs that you had, you need to remove all of them, discard all of them, and you have to set a date that you will stop the smoking. Very important, because you don't just allow the patient to go that way and you feel the patient will make out a date for his or herself. Tell the patient, when do you want to stop smoking? Ideally, 2 weeks is very important. 2 weeks is best, from the time of consultation to the time the patient want to stop smoking. Then secondly, you know, hanging out with friends that smoke or will encourage you to smoke, you have to stay away from them, at least for the main time. Stay away from them till you are being able, you know, to gather that strength, or you are able to establish that cessation, you know, in you. Then patients I've come across in the clinic, yes, it is not really easy to stop smoking. It is not. But for some other younger patients, you tell them stop smoking, yes, they go home and stop it. But other people, they don't really find it easy that way. So you have to individualize the care of your patient. You have to, you don't just, the same way you speak with this patient, you don't have to generalize things. Yeah. So you personalize the care of your patients and you take their care separately. So some you just have to patiently work with them, set a date. Sometimes they lapse after they had stopped this. Oh, doctor, I've stopped smoking. After like few months, they go back because they remember that pleasurable, you know, feeling they had with smoking. They have to go back to have it, and they start going back. You know, going is like a cycle started all over again. No, you don't have to, you know, relent. You follow up with your patient, and sometimes we get results. And, you know, constantly reminding them of the complications, which, you know, time will not even, you know, permit us to listen. You tell them, you scare them, you instill that fear in them. You know, it helps. And another thing, policy, you mentioned, rightly mentioned policy. Yes, it can be done. I know government, even within Nigeria, we have a lot of policies, you know, to stop smoking or to reduce the rate of smoking, you know, but we are not really achieving it because the implementation of this policy is poor. You know, the monitoring process is poor. So if government can look in that direction, maybe increasing the taxes for smoking, you know, attach something that will be inconvenient for the patient financially, especially during this time, I think we will be able to achieve results.
Sure. And the WHO, World Health Organization, said that since COVID-19 came about, a lot of smokers have been willing to quit the habit, but less of them are actually able to do so. How has COVID, what impact has this dimension had on smokers?
Even statistics, yes, thank you very much, sir. Statistics shows that 40% of patients that are willing to quit, only 4%.
4%.
Yes, only 4% end up, you know, quitting this smoking. It is not really easy. But you know that COVID itself, you know, it has a lot of complications, even closely associated with tobacco. You know, you can imagine, we know that COVID causes thromboembolic complication. We also know that smoking causes thromboembolic problems, because I said it thickens our blood, it forms clots, and that's the same thing COVID does. So you can imagine a patient that is a chain smoker, already the lungs are being destroyed, there are a lot of plaques, the blood vessels are narrowed, we have a lot of clots here, and they're coming down with COVID. You know that COVID will be severe, there is no two ways about it. So some of them, because of this care, because they have relatives who are smokers coming down with COVID, and they couldn't escape it. The mortality was quite high. So they are willing, you know, to quit, but they cannot, still because of the same thing. It's addictive. Tobacco has addictive, you know, properties in it. So that is just what is the problem. Many of them, if we are to look at them properly, they want to quit, but they cannot. So I think counseling is like the number one remedy we have to constantly apply to this patient. Then we add pharmacotherapy, which are drugs, to assist them.
All right. In your experience, no doubt you've come across a lot of people who have been heavy smokers for several years, but yet they do not display any health issues. Can you explain that to us? How some people escape, if you like, the adverse effects of smoking, while others are more prone to it?
Okay, so seeing a patient without any clinical manifestation, or seeing a patient without any symptom or with any symptom of any type, you know, a patient that is a chain smoker, doesn't mean that the patient doesn't have problems with them. Yes, because we have a lot of patients, they present in the clinic without any clear symptoms, and they have that history of significant cigarette smoking. You do their lung function test, it will be, you will see either obstructive or restrictive pattern. That is, there is a problem. But maybe the problem is not up to the level of the patient coming down with cough or difficulty in breathing. You can also take the blood of the patient. You know, there may be some viscosity effect, that the blood may be thickened, but it is not to the level of the blood forming clots and beginning to have organ problems. So I can't really say the impact of smoking is so much, irrespective of the duration. The patient may not present with any obvious symptom, but the problem is there is progressive, and you know some of these problems are progressive. It starts from a particular stage, it goes on and on. So if the smoking is going on, the progression continues till when it finally lands and patient now present with symptoms. So I cannot categorically say patient is smoking and doesn't have a patient may not have any clear symptoms looking at the patient, but with them, if you do some investigation, check the blood, do some imaging and other things, you may discover some incidental findings in this patient.
All right. We talked earlier about passive smoking. How do those who are non-smokers, what exactly is it? How are they being affected by those who may be smoking around them?
Yeah. Passive smoking is equally bad. That is why government must restrict. There should be restriction of smoking. There should be restriction of smoking. It's been said that about 8 million people globally die of smoking. Then, out of these 8 million that dies globally, about 7 million of them die due to direct impact of smoking. As in, they are the ones that smoke,
so
and
more
they die.
Non-smokers are dying than smokers.
Then 1.3 million of these dead are seen in passive smokers. Non-smokers, they never smoked in their life, just because they happen to be in an environment that someone smokes and they inhale the smoke. So you can imagine somebody dying for what he or she doesn't know about. So passive smoking is important, very, very important. If you find yourself in any area, any environment that you perceive smoke, you know that something is wrong somewhere, leave that environment or use your face mask, stay away from there, because you are also indirectly exposing yourself to the effect of tobacco.
Sure. And just lastly, very briefly, what is your words of advice and encouragement to those who are heavily into smoking but want to stop? What can you say to them?
Yeah, my word of encouragement to those that are smoking, it is not the end of the world. Yes, you can do it. Believe in yourself. It can be done. I've seen so many of them quitting at the end of the day. It's a project you have to handle. Nobody can do that fight for you. It's just for you to sit down and talk to yourself that you can do it, and yes, you can do it. You know, set a date that you will stop smoking and stop the smoking. And if you know that you cannot stop, you have to seek for help. Go to any good hospital with a respiratory unit, present your case, because we have different options that we can give to you to help you stop smoking. I've mentioned nicotine replacement therapy for those that cannot quit smoking. It is available, and it helps to, you know, increase the chances of patients stopping smoking. Yes, it increases by 2, which is good. So those options will be offered to you, and you will stop quitting, and you will quit smoking. And when you quit smoking, yes, you know, it's like a way of running away from problem. Early date, which is associated with smoking, complications and so on.
Sure.
Thank you so much.
All right, Dr. Dorcas Obidia Okoro. Thanks for finding time to be with us, Senior Registrar, Respiratory Unit at the National Hospital Abuja. Many thanks for sharing your expertise with us on this topic and your words of encouragement and advice. Thank you.
Yeah, thank you, sir, for having me.
You're very welcome. And to you out there, thanks for watching. Nigeria Today is live every weekday at 7:30 in the evening. Also catch this and other editions of the program on youtube.com/NTA News 24 Hub. I'm Dennis at Digmo. Many thanks for watching. Thank you much.
Thank you.